All right, hello, we're group 10 with Nasser, Michael, Priscilla, and Angelina. We are addressing Bill HR 6586, which is Reducing Obesity in Youth Act of 2018, and we are addressing childhood obesity in America. So what is obesity? The CDC defines it as weight that is higher than what is considered healthy for a given height, and obesity is measured by BMI, which is body mass index. It looks at the proportion of weight and height. In children, obesity is defined as at or above the 95th percentile for BMI. So the issue of childhood obesity goes back to the 1970s and continues to rise into the early 2000s. To combat this, a lifestyle of healthy eating and physical activity is encouraged, and healthy eating is defined by the CDC as following the 2020 to 2025 dietary guidelines. So our current situation, 12.7% of children ages 2 to 5 are obese, and this number rises to 20.7% in children ages 6 to 11. 30% of children participate in about 20 minutes of vigorous physical activity daily, but 60 minutes is the daily recommended amount. Behavioral and medical, as well as other individual factors, including lack of physical activity and socioeconomic status, are all attributed to childhood obesity. Unhealthy diets in children increase long-term risk of non-communicable diseases such as hypertension, CVD, diabetes, and cancers. And those are both problems for our current situation. So with our figure, it shows that non-Hispanic Black girls, Hispanic boys, as well as Mexican American boys have the highest percentage of childhood obesity. So some facts to note from this figure is that more than 1 in 6 non-Hispanic white boys have obesity, and more than 1 in 7 non-Hispanic white girls have obesity, and about 1 in 8 non-Hispanic Asian boys and about 1 in 20 non-Hispanic Asian girls have obesity. Additionally, nearly 1 in 5 non-Hispanic Black boys and more than 2 in 7 non-Hispanic Black girls have obesity.
So our policy solution, the proposed policy is HR 6586, which is Reducing Obesity in Youth Act of 2018. The purpose is to promote healthy eating and physical activity amongst youth through the use of grants. These grants will be used to provide training, technical assistance, and resources to entities implementing these courses of action. Work directly with partners in order to create a sustainable and lasting program to train early care educators. Enter a contract with a nonprofit organization to evaluate the programs carried out under the grant. For implementation, the bill will be introduced to the House but has not been passed further. Key objectives. So we're funding for education early care centers. Through the use of grants, the policy will look to reduce child obesity rates among children ages 0 through 6. Resources for implementation, the resources provided through this policy will allow educational and early care providers to successfully engage children in physical activity and healthy eating habits. So for our policy landscape, the first policy is Access to Healthy Food for Young Children Act of 2021. This federal bill amends the National School Lunch Act that improves areas in the child and adult care food program, such as providing funding for nutritional training and to increase participation of children in underserved communities. The public is supportive with the idea of having better policy for school nutrition education programs, and having more nutritional foods available in school. According to a survey of 1,800 students and parents across the nation, more than half of the students and parents agree that healthier school meals lead to better performance in school. Our second policy is Safe Routes to School Expansion Act of 2021. The goal of this federal act is to provide to school by building or rebuilding sidewalks, crosswalks, signs, and bus stops, all funded by the Department of Transportation. The public opinion is that majority of parents felt that commuting to school would be fun or healthy for their children. What keeps them from making the commute is the safety or convenience of the route to school. Our last policy is the National Physical Education and Sports Week. The purpose of this federal bill is to encourage the importance of physical education to create and maintain a healthy lifestyle for children. The public feels that physical education is important to have in schools. According to a study conducted by the Harvard School of Public Health, 1,378 parents were polled, and 68% of them reported that their children do not receive daily physical education in their schools. With this concern, the lack of physical education could lead to health concerns in the future for these children.
And here we have the logic model. We have 2 paths. So at the top, input 1, we're implementing staff. This could be done through training teachers and nutritionalists. This leads to our first activity through the implementation and promotion of healthy eating and physical activity. This can be seen in section 3C, number 2. This leads to our first output of reporting on each education and early care center's progress. And the long-term impact is to decrease prevalence of cardiovascular disease among racial ethnic minority groups. The second input is to provide funds. This is done through grant distribution and sponsors. This leads to our activity of developing healthier education and early care environments. This can be seen in section 3A. And the output for this is to track money that is granted out each fiscal year. As for outcomes, following this second path, we have a short-term outcome, which is increasing awareness of grants for education and early care centers. An intermediate outcome of this is to push for physical activity and other healthy eating-oriented activities. And a long-term impact of this is to reduce childhood obesity rates among minority, racial, and ethnic groups. Evaluation questions. Firstly, we have the short term. Did HR 6586 raise awareness of grants for education and early care centers? For intermediate, did HR 6586 advocate for activities centered around physical activity and healthy eating? And long-term, did HR 6586 decrease prevalence of cardiovascular diseases among racial ethnic minority groups? For evaluation design, we'll be focusing on the long term. So the question is, did HR 6586 decrease prevalence of cardiovascular diseases among racial ethnic minority groups? The design we'll be focusing on is quasi-experimental, specifically time series. Our justification for this is that it's going to allow us to take previous data and compare it to future data after policy implementation, as the amount of data on cardiovascular disease is very extensive. Data to track this will be used with a tracking network that gathers data from the U.S. Census Bureau and the National Center of Health Statistics. The hospital and emergency room data is organized by state, which is assessed by the U.S. Census Bureau, and death certificates are obtained from the National Center of Health Statistics. The prevalence of heart attacks and heart disease is measured through surveys like the National Health and Nutrition Examination Survey, or a large cohort of studies like atherosclerosis risk in community studies. As for the time frame of our design, we'll be looking at 5 years before and after the policy is implemented. So this is going to be from July 2013 to July of 2023. We would compare death rates, prevalence, and incidence of cardiovascular health among children.
So the evaluation challenges, there would be one that we come across is lack of time. Early childhood educators not having the time to incorporate an increase of nutrition/physical activity into the curriculum. Also, unclear solution, the inability to track down the direct factor that addresses the impact. And lastly, lack of participation, the difficulty of ensuring children's participation due to potential external influences and not being in school 24/7. And 3 health equity implications. The first one is community engagement and collaboration. Engaging/collaborating with community organizations such as grants and sponsors can help adjust physical activity and nutritional initiatives to be culturally relevant and accessible for children from different communities. Our second one is access to resources, providing nutritious food education/options for children and creating safe, accessible spaces for physical activity in schools, offering equal opportunities for all children to engage in healthy lifestyles. Our third one is equitable health literacy and education, comprehensive and culturally appropriate health education aids children from diverse backgrounds to develop the knowledge and skills needed to make informed decisions leading to better health outcomes. And our open-ended question is, what can be added to HR 6586 in order to provide support for parents and ensure progress with the results of implementation once children leave early education centers? And that is our presentation. Thank you.
I'm fucking pissed off, yo. I thought I changed the slide. It's a cardiovascular and it said chronic. That shit threw me off. No way.
No, I think we're chill. If you want to redo it, I'm down to redo
No,
it, but.
no, I didn't want to stop. Oh my god.
I think it's because it has to be like refreshed on the Zoom, maybe.
Maybe.
Yeah.
Oh my, that shit made me stutter. I was like, do I say chronic? Do I just say cardiovascular? So.
I think
Because on the actual slide.